Hello friends, Nerd Pediatrician here. Let's talk about fever. I get many calls and visits from parents about their child with fever, telling me how high the temperature is, exactly what time it occurred, and understandably sometimes they are freaking out. I'd like to give you some information about fever so that hopefully you can feel a little bit better the next time your child has an elevated temperature. Let's start with this. Fever is a naturally occurring phenomenon. It is not necessarily bad, and not all fever needs to be treated. Of course, disclaimer first, this information is being presented for educational purposes. It is not intended to diagnose or treat your sick child. Definitions first. Fever is an elevation in the body's temperature, which is a natural response to a physiological stress. These stresses are typically infectious and/or inflammatory processes that all children will have at some point. It's important to know that fever is a sign and not a diagnosis. Fever is one part of the immune system's response to stress. It is part of a controlled process that occurs in a part of the brain called the hypothalamus. We sometimes compare the hypothalamus to a thermostat, so think about fever as an increase in body temperature due to an increase in the set point of the body's thermostat. Okay, let's compare fever to hyperthermia. Hyperthermia is increased body temperature due to external processes, often combined with the body's decreased ability to shed heat. Hypothermia does not involve the hypothalamus, thus it occurs in an uncontrolled fashion. A classic example that can cause hypothermia is heat stroke syndrome. So think about exercising vigorously in a really hot environment, body's producing increased heat. The increased ambient temperature decreases the body's ability to shed heat adequately, so the body temperature rises in an uncontrolled fashion, potentially to a dangerous level. Okay, so fever is due to a controlled process compared to hyperthermia, which is an uncontrolled process. This distinction is important because while increased body temperature from hypothermia can potentially be dangerous and in fact deadly, elevated body temperature from a fever rarely, if ever, is dangerous. In fact, there's lots of evidence that says that fever in response to an infection helps the body fight off that infectious process. One more definition. Technically speaking, those of us in healthcare define a fever as 100.4 degrees Fahrenheit or higher. Why the significant digit? Well, 100.4 equals 38 degrees Celsius. And it took me way longer to realize that than I care to admit. Yes, but frequently I hear complaints about low-grade fever, higher than normal temperature. What does it all mean? Well, body temperature actually fluctuates all day long because of the hypothalamus. However, let's agree that an elevated body temperature is what matters and not get hung up on the details. What's more important is how the child looks and feels and is acting. If your child has a temperature of 101 but is running around like a normal 4-year-old and it doesn't seem to be bothering him, no big deal. But if the temperature is 100.3 and your kid looks like he's having a bad time, go ahead and break out the medication to bring down that fever. It's worth repeating that not all fevers need to be treated with medication. Let's dispel a few fever myths so that hopefully we can collectively improve our fever phobia. Myth number 1, without treatment, a fever will continue to rise. Well, we already discussed that this is a controlled process thanks to our friend the hypothalamus, so we know that that is in fact a myth. Myth number 2, how high the temperature is correlates with how serious the infection is. Here's the thing, the cause of any fever may be serious or maybe not that serious. We know that many common childhood viral illnesses cause really high fevers, and these infections get better on their own. To quote, well, myself, a fever is a fever, let's move on. Exactly. Sorry I'm late. I was checking out some cool birds in the backyard. Well, I guess that makes you more like the bird pediatrician. Hilarious. Finally, myth number 3. If you can't break the fever, the cause is very serious. In actuality, temperatures that don't come down to normal with treatment can be caused by a variety of reasons. The response to medication tells us nothing about the cause of the illness. Here's an important caveat though. A fever in a baby less than 3 months of age is always an emergency. Without getting into an additional science lesson, babies are both more prone to and less able to fight off serious infections. In these cases, pediatricians shoot first and ask questions later, so you should always seek immediate medical attention for a fever in a young infant. Hippocrates said, "Give me a fever, and I will cure all disease." An indication of his insight that fever is helpful in the fight against infection. Thank you so much for watching. I hope this information was helpful and helps you to think cool the next time your child has a fever. If you're enjoying these videos, please consider subscribing. Thanks again, Nerd Pediatrician out.